to mention, we have 6 branches in total at the moment. We have 2 in Lavington, we have 1 in Westlands, we have a wellness center, a dedicated wellness center, we have 1 in Nyali, Mombasa, and we have a fully fledged virtual center. Our founding father and the co-founder have mentioned this morning, the journey was not easy to get here. But right now, when you walk into one of the rooms, I hope you all got an opportunity to go into the rooms and to see the spaces in which the environment of care for our patients. It has taken 30 years or slightly more to build this and to make a patient very comfortable in the space in which they stay. We talk about stigma around mental health. When someone calls in to say, I'd like to come in for care, and they say, can I just come, pop in and see what it looks like first and see if it's a place I'd want to be, and we give them a tour of the place, don't you think they'd want to be here? Just like our director, Dr. Konji, mentioned. So the legacy is for sure. If you put together all the years of our founding fathers, it's more than 100 years, you'd say, because in the practice of psychiatry itself, it's more than 40 years for each of them combined. So all these years, we have been able to acquire the trust or to earn the trust. We say you earn trust, right? You don't go saying, please trust me. Trust me, just come, come see me, trust me. It has taken years of building and resilience and to ensure that we give care to our patients and they can recover in dignity. But at the same time, because of the work that has gone into preparing these spaces for care to our patients, we can say we become an authority in the region and globally even, because we continue to give quality in the services that we give our people. Now, in our 30-year legacy, it is anchored on people. We wouldn't be here today if it was not the people. People in various ways. Number 1 is our clients. Our services are client-centric. We also have a unique asset that drives this work that we give every day. We have the working force. I'll just mention briefly, we have a panel of 88 medical professionals as at today who work in Chiromo, who are empaneled to work in Chiromo. Of these 88, 68 are psychiatrists. Of these 68, about 57 are external admitting psychiatrists. And we have 13 employed by the institution and supported by institution and learn every day through our chairman. So those are our corporate psychiatrists. Other than this group, we have a team of nurses that stands at 134. That is about 85 nurses and about 40 patient attendants. We have 14 pharmacy teams and laboratory teams. The teams are big, that provide care here. It's a unique asset because, 1, we take time to teach. This has come out, We have CMEs that we have every week without fail, every Monday morning. And even the chair of the Medical Advisory Committee joins in on these presentations to chime in. Together with that, we have our M&Ms that we have every month, so our mortality and morbidity meetings. You'd be shocked. Sometimes people ask, might it be necessary to hold M&Ms in a specialized psychiatric hospital? It is very important because of this, we've been able to monitor our patient outcomes better, monitor our great saves, and anything that we could have missed and continually improve. So multidisciplinary approach is very vital and we ensure it works here. Our teams have continued to grow. I know as the presentations continue, they'll mention that we have partnerships that enable us to have advanced diploma programs for our teams. So as we launch various things to just get the message out there on mental health and recovery in dignity, we invite them to work with us in this space because we cannot do it by ourselves. And that is why we are honored that you came here today to just listen to what we do. When we have launched a program or opened our facilities, we have various key stakeholders, probably just also persons of authority in the country just come in to truly affirm and even to the public that mental health is not something, mental health issues or problems or illnesses are not things to be ashamed about. So we have been loud about it, and because of that, People have seen it and have come to endorse also what it is that we do in Chiromo. We have protocols that we follow. Our protocols are stress tested. There's nothing that goes out there that our chairman of the Medical Advisory Committee does not know about. We have a lot of globally validated tools that we use within Chiromo just to ensure that what we offer our patients, one, is evidence-based, and two, can be backed up by science. You don't just think, oh, this might work, and put it out there. We're big on data and technology, so this will go together. For a long time, we wrote on files for quite some time, on physical files. The blue files, I know at the admitting psychiatrists would know them. But today, when you go to the wards, you will not have a file to write on. But the beauty is that all your old notes are already scanned and put for you in the system. So our HMIS system is called the CHG 365. It covers everything. But it has enabled us to digitize all our processes. There's nothing that is written on paper. And also, we've made it easy for the consultants to write notes. They speech to text, so just you can speak to your patient and the notes will be typed out for you automatically. But also, we have AI. We have an AI copilot scribe for CHG at the moment. It is in the process of development. Our chairman and our director of MAC have tested it themselves. And they can tell you that you'll speak to your patient and the notes will be typed out for you, and at a click of a button, you save and move on. Of course, it has a human layer, so you're able to check and see if there's something that could have been missed or something that you want to enhance. So we're big on technology on that. And now to our follow-up program. Anytime we talk about any business, we talk about patient acquisition and patient retention, but that is not even the strategy. When you give someone care, it is good to also give them kind of like after-sales service, for lack of a better term to use. We have something we call the Structured Quality Management Integrated Follow-Up Program. What is this? It is very deep. It is not just a follow-up program that we have for our patients in Chiromo. It's a program that has been curated and at the moment has about 13,500 active patients, the ones we can tell you at a click of a button, we know exactly where this patient is today, And through this program, we've been able to trace to the very first patients that were seen in Chiromo. We know we started out from about 11 patients in 1995, 1996. 2026, we have over 100,000 files, actually, so both inpatient and outpatient. And we can trace right to the lady who designed the mother hospital, our acute care center currently in Westlands. She's a patient of our chairman, Professor Njenga, and we know where she is because we called her through our follow-up program, and we knew where she was because we dated back to just get all the data together, and we can link patients back to care. Why is this important? This follow-up program looks at 56 metrics, individual metrics. We initially had 48 metrics. When we loaded in a special category of patients, we had other metrics that we added. Currently, it stands at 56 metrics. And we have a framework that we have built for follow-up, something that we were able to publish and show that truly when you follow up your patients, you reduce relapse rates, you reduce readmissions ultimately. And even when they come to the hospital, the average length of stay is not long. These are key metrics that just speak to the quality in Chiromo. I would tell you today, our average length of stay is 7.6 days in Chiromo. So that's about, whether you want to make it 8 days or 7 days, that's a week. This is for all conditions that we treat in Chiromo. Whether you came with something to do with psychosis, whether it was depression, whatever it could be, of all our patients, it takes us about 7 days to stabilize them, and then they can move on, either is it to rehabilitation or probably back home, and we keep patients functional in society. What is our readmission rate? Because it makes up part of the quality initiatives that we have. Our readmission rate stands at 12.2%. Globally, we know it's about acceptable for a year, about 33%. So we're way below half, of what is acceptable, even in psychiatry. We track readmission rate at the 3-month mark, at the 6-month mark, and at the 12-month mark. So cumulatively, it's at that. If within 3 months you are readmitted back to the hospital, of course we sit as a team and we think, what could we have missed something? Or you're probably just an outlier, maybe there's something deeper that we missed. Also, we get feedback from our patients. That is through the Net Promoter Score. This is important because anybody who doesn't want to be corrected will never learn, will never grow, So through our Net Promoter Score, we get feedback from our patients. Our latest Net Promoter Score cumulatively for all our 6 branches was 87% for the last quarter, which we think is admirable, and we keep growing every day. And we also look at legal matters and legal perspectives. We are licensed as data handlers, data processors, data controllers, in Chiromo. And we've done 3 trainings already from the Office of the Data Protection Commissioner to just ensure that we're in line with that. So what is our future-facing anchors? What are they? We talked about partnerships. Partnerships enable us to go long-term in the game. You cannot do things alone. I can see Dr. Matolo, in the insurance space, especially. Remember, a lot of the patients actually are insured. And currently, Chiromo commands 60% of the insured pool in the private space, So the partnerships that we have with the insurance companies or the underwriters, with other hospitals just for referral programs, ensure that we not only give services here, but we go beyond. We've digitized all our processes, like I talked about. And for training and research, we have been given feedback from our group CEO that the board has approved, and that we can continue making plans towards the establishment of the Professor Frank Njenga Training and Research Institute. So we've digitized our processes towards that to ensure that it is successful. And because the future is virtual centers, at a click of a button, you might not need to get up from your house, but you're able to be seen. This is a game changer that will be spoken about by Dr. Joseph later. It speaks to the quality and just the future of mental health. These are the modern trends in mental health, that we can give you care right where you are. You don't need to leave your house to receive the care that you need. So quality healthcare is achieved when safety, number 1, accountability and compassion or dignity that we spoke about become part of everyday practice. We are told this every single day. And a system that is built on safety, structure, and accountability is what Chiromo Hospital Group promises you. Thank you very much.